everyone. Welcome back to another episode of CHD Unpacked, a podcast about living with congenital heart disease. This podcast is brought to you by the Canadian Congenital Heart Alliance. I'm your host, Amanda, and today we'll be unpacking the topic of CHD and mental health. We're very pleased to announce that we're being joined today by Dr. Adrienne Kovacs. Dr. Adrienne Kovacs, a clinical and health psychologist, spent 17 years fully integrated within cardiology divisions, first at the University Health Network in Toronto, and later at the Oregon Health and Science University, where she was promoted to professor in 2020. She's the past president of the International Society for Adult Congenital Heart Disease, the first non-physician to lead this organization. Dr. Kovacs is a fierce advocate for the psychological care of individuals living with congenital heart disease. She has given over 150 invited presentations at national and international meetings in a dozen countries and has over 130 peer-reviewed publications. Of most relevance to this discussion, she chaired the 2022 American Heart Association Scientific Statement on Psychological Outcomes and Interventions for Individuals Living with Congenital Heart Disease. In late 2021, Dr. Kovacs returned to her hometown of Toronto, Canada, where she launched Equilibria Psychological Health. She is now duly focused on the psychological well-being of adults with congenital heart disease, as well as healthcare professionals, and maintains academic commitments in mentorship and research with long-standing collaborators. Please join me in welcoming Dr. Adrienne Kovacs. Hi, Dr. Kovacs. Welcome to CHD Unpacked. Thank you so much for joining us today.
Thank you so much, Amanda. I'm really happy to be here.
So today we're going to be talking about CHD and mental health. So to start off, would you be able to tell us a little bit about the scope of your practice?
Sure, I'd be happy to. I'm a clinical and health psychologist, and I work with two groups of individuals right now. I work with adults with health conditions, many of whom have heart disease, and many of those have congenital heart disease. In fact, I've been working with adults with congenital heart disease for 20 years so far. I began at Toronto General Hospital in the fall of 2004. And I also work now with health professionals, so physicians and nurses. So I really view things from the perspectives of both patients and the doctors who take care of them.
That's amazing. Thank you so much for telling us a bit about yourself. Would you be able to comment on some of the most commonly diagnosed mental health conditions within the CHD community?
I think when we think of psychological health and adults with congenital heart disease, we think mostly about anxiety and depression. Mm-hmm. And we've estimated that about 50%, so about 1 in 2 adults with congenital heart disease will face a clinically significant mood or anxiety disorder at some point in their lifetime. So that doesn't mean that everybody's dealing with it right now in this moment, but it's sometime in their lives. And so things like depression, we would predominantly think of depressed mood, loss of interest in things. Anxiety can be generalized anxiety. It could be panic disorder. We can also think of obsessive compulsive difficulties or dealing with trauma. So there's a lot that fits under this umbrella. And sometimes we actually just think of it broadly defined as psychological distress, because there's a lot of overlap between symptoms of depression and anxiety.
And do you know specifically the types of worry and anxiety, like where that comes from for patients with CHD, like the source of this anxiety?
Yeah, and I think I'm glad you're asking about anxiety, because although historically we've tended to speak more about depression and heart disease, we know that anxiety is more common than depression in our adults with congenital heart disease, and certainly in my own clinical practice. So probably the most common reason that people come to see me is anxiety, and more specifically, health-related anxiety. There are a lot of different reasons why people might be anxious about their health. I would say that one common theme tends to be uncertainty. So somebody might say, I'm having these physical symptoms. I'm not sure what's going on. I can't quite figure out whether they are medically concerning or not. Somebody might be worried about what their longer term health expectations might be like. Somebody might be worried about having a diagnostic procedure or going in for surgery or a catheterization procedure. Somebody might be anxious about whether or not their symptoms might interfere with their ability to finish school or to keep a job or to start a family. And we really think about congenital heart disease, as we should, as a lifespan approach. So the factors that can contribute to anxiety can present at any point in somebody's life, and they can be cumulative and interactive. So kids can sometimes struggle, as children and teenagers, absences from school, sometimes having difficulty with peers. Then we expect them to leave the nice, warm, friendly pediatric environment and transfer to adult care. And we have different resources in the adult care system. And sometimes people think that they are doing well and healthy. And for some people, the onset of heart rhythm problems or arrhythmias or heart failure symptoms can really be challenging to adapt to. And then as our patients age, for some of them, it's starting to think about long-term health expectations. So a lot of different reasons that can contribute to anxiety across somebody's lifespan.
Mm-hmm.
So and I say that because I'm never surprised when somebody tells me that they're feeling anxious or even down and depressed about something.
Mm-hmm.
They rarely do they say, I don't know why I'm feeling this way. They almost always can tell me what's triggered it.
Okay. And it seems like it's quite variable, similar to, the medical aspects of congenital heart disease itself can be quite variable from person to person. Seems like it's similar in terms of the presentation of some kind of mental health conditions that they might be facing, or even just challenges in general.
Oh, that's a great point. I think that the the physical symptom presentation, diagnosis, symptoms, treatment pathways are quite variable.
Yeah.
And similarly, their psychological outcomes can be variable. So
Mhm.
as a psychologist, I do not have a manualized approach. So nobody comes to see me and I say, here are 8 sessions, and this is what we'll talk about across these 8 sessions. It's very much responding to what their needs and what their particular challenges are kind of at this moment in time. And I think people often will say to me, Adrienne, what do you do with them? What can we, how can I help them? And it's so different depending on their specific challenges that they're facing at that time.
Yeah. And do you feel that mental health concerns are underappreciated in the CHD community as a whole? And can you comment on what kind of detrimental effects that could have if someone has mental health concerns that are going unaddressed?
Yes. So the short answer is yes, they are absolutely underaddressed. I would say that in the 20 years I've been working in ACHD, there's increased dialogue about psychological impact, psychological intervention. So in 2022, we put out a scientific statement focused on psychological outcomes and interventions in congenital heart disease across the lifespan, often at conferences or presentations about psychosocial well-being or neurodevelopmental and neurocognitive considerations. So there's a really, I would say over the past 20 years, there's been this emerged awareness that psychological health matters. There's been slower uptake of actual interventions or providing psychological care to these individuals. And one of my main initiatives that I'm always trying to push forward is this idea of embedding mental health professionals within ACHD teams, because I think, our responsibility to adults with congenital heart disease extends beyond saving their lives. And I think we have a responsibility and an opportunity to provide them with the best quality of life possible. And so I think that unfortunately, things have not moved as quickly as I would like. I get quite passionate and feisty talking about this because I think we ought to have more mental health professionals directly embedded within teams. And in terms of outcomes, so definitely, the experience of psychological distress in and of itself warrants attention and warrants intervention. It is unpleasant to be depressed. It's unpleasant to be anxious. It's unpleasant to feel stressed or angry or confused. And so that in and of itself, we ought to do something about. But we also have emerging evidence from the ACHD world, as well as the broader cardiac psychology world, that psychological distress has impacts on physical symptoms, on morbidity, on mortality. We know that depressed people have a greater risk for major adverse cardiac events. We know that it's associated with more expensive and more frequent medical encounters. So there's a lot of reasons why, not only at the individual level, but at the societal level, we ought to be devoting more resources to this group.
And do you feel that it's just a lack of resources in terms of not enough funding or not enough trained professionals for this specific population of people? Or do you know where the source of the like the lack of resources
Yeah.
coming from?
I would not say it's due to lack of trained people, because we could train them. And I say because you could, there are people, great health psychologists graduating every year who I think would jump at this and jump at a position like this. And I say because it's incredibly rewarding. The patient's wonderful to work with. So although we're talking about psychological distress, as a group, so incredibly resilient and inspiring. So I will say I absolutely love working with them. The ACHD doctors and nurses, allied health professionals, great. So I think that these will be great jobs, and we can provide that on the job training and get people up to speed with learning about congenital heart disease. I think it is, I would say, partly funding, and I would say more so in Canada, because psychologists and social workers don't bill the provincial healthcare systems for resources. In the US, they do. In the US, we bill insurance companies, so it's absolutely possible to do it there.
Okay.
I think I would associate it primarily with people not prioritizing it. And I say because, I often draw the analogy with a cancer center. You wouldn't dream of building a world-class cancer center and not embedding psychosocial oncology and palliative care. I think that our cardiovascular patients deserve the same. And I think that in healthcare, we fund what we prioritize. So I think that there's definitely room to prioritize this, which is why I would say anybody listening to this, if you are having difficulties with depression and anxiety, please, each time that you go to see your ACHD team, let them know that this is what you are seeking. And hopefully, I would say that patients are the strongest advocates. And when you mentioned awareness earlier also, patients are the one who are advocating for this. When you ask them as groups what they want more of, they will say they want access to specialized mental health care. So maybe if the teams and the higher ups in the hospital settings continue to receive this messaging, maybe there'll be higher uptake.
I really appreciate you explaining that. And I think it's so important to highlight the fact that it is a lifelong condition, and it's not something that you just receive your medical care and you can just forget about it afterwards.
Yes.
And I think the fact that because medical care has advanced so much over the years and people are living much longer and more comprehensive lives than was previously afforded through the medical system, I think that it's important to emphasize quality of life, like you were describing, and it's not something that should be made a secondary priority.
Right. And I think that's an excellent point, Amanda. We often begin papers in the ACHD world saying something like, as a result of significant advances in diagnosis and treatment, over 90% reach adulthood, they're having a lot better outcomes. And I would say, though, that psychological health is the next frontier. So yes, as a field, tremendous gains have been made to improve physical well-being, to improve longevity. This is where I think we have the opportunity to make a huge difference moving forward by attending to their psychological needs and their quality of life. So to me, this is the next frontier of ways to advance the lives, the quality of life of people with congenital heart disease.
I completely agree. And something that I'd like to touch on is the aspect of people with congenital heart disease might not feel like they look visibly ill as compared to someone with a different condition that might be a little bit more apparent to someone that just met them for the first time. And so when someone is considering, taking into account their own privacy versus disclosing the fact that they have congenital heart disease to others. Do you find that this is something that can cause people distress? And do you have any advice for how they might manage both keeping their privacy sacred in a sense, and also, being able to open up to people about their congenital heart disease?
I think that's a great question. And I think it's a bit of a tricky answer. And I think this idea of trying to balance can be can be a difficult one. So, and as you said, oftentimes, unless somebody has a scar and they're wearing a lower cut shirt or they're changing at the swimming pool, something like that, often it's really difficult to keep some of these things covered up. And I think that, sometimes it's about whether we talk about psychological safety sometimes. Is this a safe person to disclose one's history? I always say that you can choose to tell somebody something later, but you can't take back what you've already told them. So I do think choose wisely to who and when you disclose. And I think sometimes, though, it can be tricky when people don't know and somebody might, for example, be experiencing challenges that make it difficult to keep up. So the example I often think of is there could be a university student who's generally doing quite well, but doesn't have as much stamina and maybe gets a little fatigued. And so, if they're going out with their friends, if they're going to go to a couple of different places, what if they have difficulty keeping up with their friends? And so do they say something in a group environment? Do they say something to an individual? I think even when people start dating, how to disclose to somebody that they're dating. Do they tell them on the first date? Do they wait to see if they're going to become intimate? I think in work environments, if, when, how to disclose. So I think that these are tricky, sometimes conversations. And what I would say is it's important to think through carefully before opening up and thinking about what the purpose of that disclosure is. And it may be that somebody is looking for a little more patience and understanding than their groups of friends. And I will say, oftentimes people tell me that when they open up, people are very warm and receptive and caring and compassionate. So that's what I hear most often. So I'm somebody who believes that actually most people are kind, and the people I work with will say, absolutely, most people are very kind. But sometimes there have been negative experiences. So I think it's thinking through carefully when is the right time to perhaps disclose.
Mm-hmm.
And I say this, sorry, if I could add one more thing.
Yeah.
Sometimes it's balancing when to feel more like a patient and when not to. And so sometimes people will say, one of the reasons I don't want to disclose is I don't want people thinking about it with me all the time, because I don't think about it all the time also. So I think it's can be balancing times of where people are feeling relatively healthy and really relatively symptomatic. So these are all kinds of things that we often chat about in therapy.
Mm-hmm. And I think it really depends on the person's values, probably their previous experiences. If they've had positive experiences opening up to others, it's almost a positive reinforcement to continue doing that. So,
Yep. That's an excellent point. Yes, I agree.
mm-hmm. Do you have any advice for people that perhaps they've been questioned by others about their scar or something physical that could indicate that they have some kind of health condition, and they're not particularly keen to disclose to someone that's asking them about it? Do you have any advice for how to navigate that kind of situation where someone might feel a little caught off guard?
Oh, that's a great point. I think that people should disclose when they want to disclose and when they feel they would like to. I don't think anybody should ever make somebody feel pressured to disclose that information. I think it can be helpful often having a stock answer or a prepared answer,
Okay.
and or maybe one or two. So it may be that maybe it's if somebody we think is kind and well-meaning asks something and we don't want to talk about it, but we like this person, we might have a simple answer, no, thanks for asking. However, that's not something I'm choosing to talk about right now. Or, I'm here just to have fun and I'm not thinking about my health, but, thank you for your concern. So something nice and benign, but sometimes people are asked questions that come across as more intrusive and rude. And, sometimes in that moment, our answer might be, that's an inappropriate question. The individual feeling distress about it, we can, send that distress back to the other person. And so to have a respectful but firm and assertive comment, I find that an intrusive question and I'm not going to answer it, is absolutely okay.
Thank you. That's really helpful. I think it's good to have, kind of a plan in the back of your mind of how to respond to certain questions, because I think it is something that might come up for individuals with CHD, and I think it might be helpful to feel a little bit prepared.
Yeah. And I think feeling prepared and feeling assertive. And when we talk about assertive communication, it includes learning how to say no. And we ought to say no to things that are unnecessary and unfulfilling. And if it doesn't meet those criteria, we can say no.
Mhm. And just as someone with CHD myself, and as someone that's been asked this question before, something I'd like to vocalize is that I think it's important for anyone who's observing a scar or some indication of some kind of medical condition on someone else to consider the fact that people might process things differently, and you don't know how recent someone has gone through a stressful life event, or what kind of medical treatment they have been through. So asking someone a question that may seem like a past medical history might still be relevant to them today. So just to keep that in mind if you're ever choosing to ask somebody about their medical history.
Yeah, that's an excellent suggestion. Yeah, we don't know how prominent these experiences are in their current mindset.
Mhm. Just to kind of switch gears a little bit, I'd just like to ask if you can comment on how someone's mental health can be affected by additional psychosocial stressors that they might have, either if they're living with congenital heart disease, or in general, and how that might be exacerbated by someone who's coping with congenital heart disease.
Yeah. I think that congenital heart disease adds an extra layer or extra set of challenges for people's lives. And I will say that this is true whether we're talking about the person who has congenital heart disease when they were a kid, their parents and caregivers and siblings, and even as they become adults, it might be their partners and perhaps their children. So we know that and that's why we call it psychosocial. It can affect the individual as well as people around them. So
Mhm.
there can be daily stressors like dealing with symptoms or remembering to take medications. There can be things like, stresses of school or finances or job or relationships. So, and sometimes there can just be extra challenges in those domains in congenital heart disease. So work might be stressful in and of itself, but it might be more problematic if somebody's dealing with some arrhythmias or if they have more fatigue because of the heart condition. When we talk about family planning and so decisions, whether or not to pursue parenthood, again, there can be some extra challenges because for some people there are unique considerations with contraception and having children and things like that. So it's just can just create a few other challenges along the way. And I will say, though, that in addition to creating some challenges, it also creates some unique opportunities to learn resilience and coping skills. And so I'm being very sincere when I say that people, when I meet everybody for the first time, I always, toward the end, I will say, let me know what helps you cope, what helps you manage these stressors. And people describe things like, they have a good sense of humor, or they know what's really important in life, or they have learned to be patient, for example, or they've learned to recognize good people in their lives. So while congenital heart disease can produce original extra stressors, it can also produce these extra opportunities. And so oftentimes, people in their 20s or 30s with congenital heart disease might come across as wiser in their years because of what they've been through. And they tend to sometimes be more intentional in what they choose to do.
I really appreciate you saying that. And I think that highlighting resilience is something that's very empowering to the person themselves too. And, if they can recognize that attribute within themselves, I think that that's really positive and will help them moving forward as well.
Yeah. Yeah. And sometimes people, we use language sometimes, exaggerated language. People might say, I can't cope with this, I can't do this. And the truth is they have been. So everybody, every adult with congenital heart disease has been coping with it in some way or another. Maybe they want to learn new or more effective coping strategies. Everybody has some way to manage what they've been going through.
For sure, for sure. And sometimes people have experiences that create stress. They might have experienced some trauma, and they might process these emotions at different rates. Can you address why this experience may differ amongst those with congenital heart disease, and if age plays any role in this?
Yeah, I think that's a great question. We talk a lot about stress and trauma these days, and I think I always like to remind people that not all stress becomes trauma, and not all trauma leads to PTSD. But some of our adults with congenital heart disease will recall really difficult pediatric experiences. So sometimes it may be they remember being in the hospital after surgery, or they remember being separated from caregivers or parents. Sometimes people will remember in adolescence or young adulthood having medical encounters where they felt dismissed by a clinician, or they felt that they were unprepared for something that was going to happen to them. So there can be these negative experiences, and sometimes they're very aware of them, and they will, be aware of these, kind of not all the time, but just kind of these thoughts will be present throughout their lives. And then there are other people who will say, I never thought about it. I never reflected on that. But now that I'm an adult, now that I'm in my 30s or 40s, I haven't had surgery for decades. And now that they're recommending surgery again, I'm remembering what it was like to be this frightened 4-year-old or 12-year-old or 20-year-old. And so sometimes these things that maybe were downplayed really just reemerge in prominence as they're being asked to revisit those same kind of situations. Mm-hmm. And so when we talk about trauma-informed care, we're really encouraging clinicians to inquire about somebody's past to figure out how they can make their future healthcare experiences more comfortable. And at the same time, I do actually encourage the people who I work with that if there's a negative health experience from their past, or if there's something that they know about themselves that would help their medical team take better care of them, to let them know, to be able to say, I have this difficult experience, or my biggest fear about going into this procedure is this. So the more that a person can disclose things like that, it makes it, I think, easier for their team to help them to maybe avoid some of those or mitigate some of those scary scenarios.
I think that's a really important message. And I think that puts the person with congenital heart disease kind of at the forefront of their own care, and really makes them a part of the team, as opposed to feeling on the outside and having others make decisions for them. I think that it's really empowering to start to have those conversations.
Yeah. Sometimes when I talk to patients about patient-doctor communication, I'll say, think about an opening statement, which is, especially if it's a new doctor, but it could be a follow-up visit, just at the beginning saying, this is what I'm hoping to get out of the visit, or this is something that I think is really important to know about me. Because if we want to avoid them making assumptions, we want to help the doctors and nurses avoid making assumptions, let's give them information that explains the uniqueness of ourselves.
I think that's a really great message. Thank you for that. For someone that is looking for resources, or trying to find ways to improve their mental health, or just looking for support in general, do you have any advice for them?
So a couple things. We wrote this document, a group of us, a couple of years ago, and we made a patient companion version of that. So I think that information will be on the CCHA website. Mm-hmm. The other thing is there's this excellent book that I love, and I'm going to see if I can hold it up on my camera here. So it's called Healing Hearts and Minds, A Holistic Approach to Coping Well with Congenital Heart Disease. And it was written by Tracy Levesque, a social worker, and Lisa Morton, a psychologist. Tracy is in the US, Lisa is in Scotland, and They both actually are mental health professionals and they have congenital heart disease themselves. And I absolutely love this book. I wrote one of the blurbs on the back of it. That's how much I love this book. And it really does a great job of going into a lot of different coping strategies. So I think that this is something, if somebody is the kind of person, particularly who likes reading from home, or they can do this to augment therapy. But when I read this book, I thought it's so much of what I do in my own clinical practice. So I think it is a fantastic, fantastic resource. And then I think if people are interested in seeking psychological support themselves, you know, if there's nobody who's easy to see or local to them, who who works with cardiac patients or people with congenital heart disease or heart disease in general, really looking for a health psychologist is really advisable. Or, and it might be a registered psychotherapist or licensed clinical social worker as well, but really focusing on somebody who has experience within the health domain. I think that's what can be particularly helpful as well. And oftentimes it's reaching out and asking, it might be family doctors or the ACHD team, if they can at least recommend a health professional in their community. And I think the more that we share this collective voice and this collective advocacy, hopefully we will be able to embed more mental health professionals within the teams themselves.
That's great. Thank you so much. I think having conversations like this is just taking one step closer to that, and hopefully we can make this conversation more widespread amongst the CHD community and just throughout the healthcare system in general. So thank you so
I
much.
hope so.
Yeah, I hope so too. Thank you so much for joining us today, Dr. Kovacs, and
Uh,
for educating us on this very important topic.
Thank you very much. It's been a pleasure. Thank you.